Hi, my name is Dr. Charlotte. I'm with Alpine Fit Physical Therapy in Boulder, Colorado, and today we're going to be talking about the spine. This is our lumbar spine. So these little yellow structures are nerve roots as they come out through the foramen, which are holes created from the vertebrae stacking on top of each other. So where our vertebrae come together on the back, where they articulate right here, this is called a facet joint. So our facet joints in the low back can actually contribute a lot to low back pain, and this is often referred to as somatic pain. These facet joints get irritated because they have a lot of ligaments, nerves, muscles surrounding them, and they actually can refer pain either all the way down into the glute area or to the SI area. So two common areas in the lumbar spine that get facet joint irritation are our L1 and our L2. Higher up in the spine, this area can refer down to the SI joint area or even sometimes to the front of the hip. Another common area that facet joint can get irritated is at your L5, S1 articulation. So where your L5 connects to your sacrum, this spot can refer even farther down the legs or just generally across the low back to give you that whole low back aching feeling that we see a lot in our low back patients. This is a great low back exercise to get those facet joints and the vertebra moving to kind of take some pressure off of those irritated facet joints or the nerve roots themselves that could be involved. So this is called a pelvic tilt. So you're going to lay on your back in this position with your knees bent, back flat on the table. From here, I want you to place your hands on your hips. All the motion that we're about to get should come from our low back. Your hips and your upper spine should stay on the table the whole time. We're just focusing on this portion here. So to start this exercise, I want you to think about rocking your hips forward, which is going to cause my low back to arch and come off the table. From here, you're going to rock your hips back and think about tucking your tail like a dog in trouble. And this is going to cause that low back to flatten against the table. So you're going to rock the hips forward, arch the low back, and then flatten the low back against the table as you rock back. And just rock backwards and forwards about 20 times.